Think we're back up. All right.
There we go. Okay, Senator Kushner, back to you.
Thank you. I was just suggesting that having historical data there would be helpful to the extent it can be provided because of the major changes that were made in 2017 in reducing agency staffing. I know that happened in other agencies. I'm not as familiar with DCF and to what extent that might have happened in DCF as well. But I think that historical data would be helpful as well.
Okay, we'll add it to the list. Thank you.
We've lost the commissioner.
Yeah.
We apologize for the technical issues.
I just chatted her on the side to ask her to come back in if she can.
Okay, terrific.
I think there's a couple people in the waiting room if they can be let in.
Hi, I'm sorry. My screen like glitched and it wouldn't let me. Sorry, we're having lots of technical difficulties. I'm sorry.
Not a worry. It's a tricky day out there with all the weather. And so for those who are just joining, Senator Kushner was just asking for the historical data so that we can have a potential to compare between where we are now and before there were major changes in employment and staffing rates in 2017 due to the budget at that point.
And just for level setting, the consent decree, DCF came out from under that I've heard different dates. I thought it was 18, but I could be wrong.
I think it's 21.
Was it 21, Commissioner?
I'd have to go back and confirm him. I was not here at the time, but I think it was, Fred, do you know the exact year it was? But we can get it for the group. But
it was either 21 or 22.
Yeah. I think so. So what we can confirm that. But also I think just we'll have the mic for a quick second is agreed 100% on the impact, right? That the workforce has and being able to sort of track trends in that. What are we seeing? How can we impact it? And what might be a good suggestion is as we're thinking about the things that we all collectively are looking to collect and evaluate and assess, some may be things that are suitable and appropriate for this dashboard that we're here to convene on. Others might be things that we just want to think about ways we can with the legislators and others just have available and share, because I think I'm cognizant of wanting to have the resulting dashboard be consistent with what I think we're trying to do here around outcome data, specifically related to outcomes, child specific and family outcomes. Not to say the other pieces of information aren't important, but we just have to think, I'm thinking about how we might want to structure it in a way that will allow us to be able to share both things. Specifically, given the dashboard, I think is intended to the question earlier, we want this to be something, the audience will be basically the public, everybody, legislators, workers, providers, families, children, youth. And so that might be different than reports that we will want to be able to share with folks on historical trends on workforce, data and numbers. So just thinking about how as we're collecting all the things we want to look at, what we might then want to be on the actual live real-time data dashboard, outcome data dashboard, and the category of things we just want to be able to share and report on and have available so that we can manage by it. So just something to think about, because I think they might be in two categories, but equally important.
Thank you. Fred.
So the consent decree ended March 24th, 22.
Was 22. Okay.
Yep, it was 22. And then by way of taking note of details we will end up needing to decide on. Totally appreciate the point about historical data. I'm a big fan of trends. I figured on that second layer of where you start disaggregations, comparing things by trend or geography would probably be one of the top level types of things. The decision point is always how far back do we go? There is a real limitation sometimes with certain data sets that raises IT limitations. You know, if you go back really far, you're talking lots and lots of data. It slows things down in terms of performance of the site itself. So you want to strike a good balance between far enough to be useful and answer the questions that you're really trying to ask of the data, but not so far that we bog the whole site down. So 5 years, 10 years, 15 years maybe is too much, but something we'll have to think about.
I agree on that. I think that sometimes going too far back ends up muddying the waters instead of giving us a clearer picture. So certainly that's something that we need to have a conversation around. Okay. I think we're at the point. I know that Mia is tracking all this information to give us out minutes from this meeting. And where, Mary, do you think we should go next on this? I do have some other suggestions that Representative Paris wanted us to speak to, and I can do that first. And then do you want to talk a little bit about next steps in terms of direction and timing of meetings, and not the dates per se, but timing, you know, to get the work done. So Representative Harris asked for quarterly data refreshes so that we are actually keeping the dashboard fresh and engaging for information. It can be very frustrating to go to a dashboard and you're trying to learn and then nothing has been refreshed since the last time you looked. So I think it's really important that we make that something that is also a priority. Hang on one sec. Okay. And then the other thing is, and I saw this on the Wisconsin website, which was permanency timeliness. So time to reunification, to adoption, or to guardianship. And I think that that's really important. They did have that on Wisconsin showing the time frame of moving in that direction. And I thought that was excellent. We mentioned the CFSR measures and the racial disproportionality and making it filterable by not too fine of a sieve, but make it in a way that we don't end up having too broad of a view of that disproportionality. I think those were all the things he had requested. In the workforce data, caseloads, vacancies, turnovers, but I think that that's something that we all would expect to see that. Okay, Mary.
So thank you, just to say thank you for everyone's time today. If you, for next steps, what we would like to do is, we were thinking about having a meeting every 2 weeks. I know that that's a little bit heavy, but it's also a really tight timeline. And it may be that once we have the first few meetings, we get into the rhythm of we've communicated what we need to do. But so we would like to send out the date, but recognizing that everyone is summertime, there's vacations and other commitments, lots of conferences going on. If each member of the work group, and we'll send this via email as well, can respond to Mia, myself, and Senator Marr with your suggestions and your policy points your priority point, excuse me, of what you would like to see. And, or anything that's come from this meeting, and any days or weeks that are just sort of no-goes for you. We don't want to discuss that on YouTube when you might not be at your house. So if you can share that with us directly, we can try to schedule a time where as many people as possible can be there for that. But at the very least, if you can send us your information, and then we can set up the next meeting to discuss the mock-up and where we have the most overlaps, and if there's any points that we are immediately seeing as not being represented in the data. And I think that was what we had talked about, Cece. Is that
That sounds great. And then the only other thing I would ask is if when the minutes come out, if everyone would read the minutes to make sure that we're capturing the things that we said we wanted to have in here. And please feel free, because, you know, we dropped the call and we've changed administrators midstream here. Let's make sure that we are, at least in the beginning, taking a look at the minutes so that we can make sure we captured what everyone wants to have in there in terms of the dashboard as we move forward. So, and then I think the next time, to your point, Mary, of seeing the mock-up and being able to then begin the edit process, at that point, we can move into subgroups to take on the work of the different areas that we see need work. Does that make sense?
Yeah.
Okay. All right.
Does everyone think that Friday would be doable for getting us that information? It wouldn't be the end of all sharing of points, just to start. Rep Main, College Main?
Hi, how are you? Thank you so much for your leadership on this. Do you have any sense yet of what, even just at a high level, the subgroup categories would be, so we can start to think about, and I don't mean to put you on the spot, but so we can start to think about, like, where would our interests and priorities be most helpful?
I don't think that we have had the opportunity to talk about it since we're just having our first meeting, but how about if we get back to everyone on that?
That would be really helpful. Thank you so much. And I understand, I don't mean to put you on the spot. I just thought, like, I can't even envision what these subgroups would be. So before the next meeting, that would be kind of good to know them categorically what those are.
Okay, thank you. Fred?
If I could just throw out maybe two possible ways of breaking out the data. One is that DCF has very specific mandates that are set forth in statute. Prevention, children's public behavioral health, child protective services, and a relatively narrow scope of education as well. So actually the mock-up that I have is organized along those four mandates. Plus, just this morning, to your point, Senator, I added an administrative or management section that would contain a whole bunch of HR metrics and that kind of content. So that's one possible way of doing it. We're also in our 5-year strategic plan. We have six major goal areas. You could organize it around those, and those: safety, permanency, well-being, racial justice, et cetera, the workforce. So that's another way. So just a couple examples that maybe help frame that discussion around how we might organize things. We could do it a completely different way too, but those are, just wanted to seed that conversation a little.
Thank you. I appreciate that. They make a tremendous amount of sense to me. So I particularly would love to see the behavioral health piece, because that is something that we don't hear much of. So much of the attention is on child protective services, and yet DCF has oversight of children's behavioral health for the entire state. And I'm not quite sure people even know that, nor do they think of DCF as the first place to go when their child is in crisis. So that would be something really important to have a category around. So thank you for that. I think Rep. Wieslander and I will take a look at this and, have some conversations and get back to everyone. Sound good? Okay, so to the point about the 24th, which is this Friday, getting back to us with something that you want to see on this dashboard and or more information that you're seeking that you don't think we've talked about. Anything else there?
Just if you have any blocks of time that you are definitely not available or available, you can just want to make sure that we're trying to get as many people as possible into the next meeting.
Sounds good. Okay, so we'll look forward to hearing from everyone by Friday. Is there anything else that people feel that they were hoping we were going to touch on and we haven't? No, I don't see any raised hands. So thank you all for your time. And we appreciate you working together with us on this.
Thank you, everyone.
Thanks, everyone. Good to
Thanks,
see you.
everyone.
Bye.
Thank you.